Hello everyone. Now we are going to discuss about the platelets and their role in hemostasis. So they are the enucleated cell fragments derived from megakaryocytes in bone marrow. They played critical role in hemostasis, by forming primary plug at the site of vascular injury. So what actually happens is, after vascular injury, subendothelial von Willebrand factor exposes to platelets where platelets adhere. So this is the endothelium, this is the subendothelium. After injury, the subendothelium exposes there is a von Willebrand factor at the subendothelium which attaches or have receptor for the platelets. Now we will see what are the events take place and what are the receptor involved in this adhesion of platelet to the von Willebrand factor. So first we will see the receptor of platelet. So this is the platelet. Platelet has glycoprotein 1V receptor, glycoprotein 2B and 3A receptor. We will see their application. So the first step is platelet adhesion. When subendothelial von Willebrand factor exposes, so it has a receptor for platelet glycoprotein 1V. So platelet glycoprotein 1V receptor attaches with the von Willebrand factor, which results into the adhesion of platelet to the site of injury. After the adhesion of platelet with the von Willebrand factor on subendothelium, the second step is platelet rapidly change their shape, results in increase surface area, conformational changes in surface receptors of platelet namely glycoprotein 2b and glycoprotein 3a, which increases their affinity for fibrinogen, increases affinity for fibrinogen, so after the injury, after the vascular injury, there is exposure of von Willebrand factor. Von Willebrand factor. Platelet adhere to this von Willebrand factor with glycoprotein 1b. And after the adhesion, there is a conformational changes in platelet. Which increases its affinity for fibrinogen, and fibrinogen increases platelet aggregation by GP2B and 3A and fibrinogen reaction. This is fibrinogen. This is platelet and this is fibrinogen. So we have discussed about the adhesion of platelet to the subendothelial von Willebrand factor by GP1V and von Willebrand factor reaction, and after the adhesion there is a conformational changes in platelet results in increased affinity of glycoprotein 2b and 3a for fibrinogen, which ultimately result into the platelet aggregation. The next event is secretion of granular contents by the platelets. Now we'll see thrombin, a G protein coupled receptor protease activated receptor 1 PAR1, this causes platelet activation, and ADP P2Y1 and P2Y12 G protein coupled receptor, which also causes platelet activation. After the activation, the last step is platelet aggregation, in which, as we have discussed, platelet has a surface receptor glycoprotein 2b and 3a, GP 2b and 3a, which with the help of fibrinogen attach with each other and result into the aggregation of platelet and primary plug formation. Now we will see some diseases, some genetic disorders. First is Bernard Solier syndrome. Whenever there is deficiency of glycoprotein 1V receptor, this result in decrease adhesion of platelets to the subendothelium, bone blebrand factors. So there will be no adhesion in Bernard Solier syndrome. Another condition is Glanzmann thromboasthenia. Glanzmann thromboasthenia. Deficiency of GP 2B and 3A receptors. Deficiency of GP2B 3A complex will result into defective platelet aggregation, the third is von Willebrand disease due to the deficiency of von Willebrand factor. This may affect the platelet adhesion and clotting of the blood. Now we will see the different granules of the platelet. So the platelet granules, there are two types of granules, alpha granules and delta or dense granules. Under the alpha granules we have different secretory agents or different factors, namely P-selectin, fibrinogen, factor 5, von Willebrand factor, fibronectin, platelet factor 4, PDGF, tissue growth factor beta. In delta or dense granules, it contains ADP, ATP, calcium, serotonin and epinephrine. So platelet has mainly two granules, alpha and delta or dense granules, and these are the content they have as we have discussed. Thank you.